Hi, this is Dr. Kristina Hammer coming from Vibrancy VIP MedClinic here to talk to you about Juvederm Fillers. Juvederm Fillers is an injectable treatment option for our fine lines and wrinkles from the aging that we've lost from our fat pads as well as the collagen production. So when we lose our fat pads in time, what happens is our face starts to drag just like a little dog. I always think of like a beagle dog because that face kind of comes down just like that. The Juvederm fillers are designed to help fill in that space that's creating those deep lines and wrinkles, such as our nasolabial folds, maybe our lack of volume in our cheeks, as well as those luscious lips that we use for kissing. A lot of times we lose that collagen as well as that fullness as we age because of lack of hormones, imbalanced hormones, as well as just gravity. So those Juvederm fillers are there to help plump it up and make us look refreshed and renewed. Juvederm fillers consist of a material called hyaluronic acid, which we already have in our body, so all it's doing is just adding back that volume. We have lots of different filler types, and the way that we determine which filler is right for a person depends on the volume loss of that individual particular person. So I like to tell people that hyaluronic acid that filler is consisted of is hydrophilic, which means it brings in water, which plumps up that space. I always like to say when people are in for a consult, when we're determining and looking all over the face of those fine lines and wrinkles, we are determining if someone is a great candidate for it. So I tell people not everybody is going to be a candidate because some people are just born with luscious lips and we don't want to distort the natural look that they're given. So a lot of the times when we're looking at a person, we're kind of deciphering, hey, are they a good candidate for fillers or not? Now, a lot of my patients can be anywhere from 18 to even in their 80s or 90s. There is not an age range for the product, but what I like to tell people is it's going to add back that volume, whether it's the loss in our cheeks, our luscious lips, or even maybe those nasolabial that comes in time with those folds because of the lack of volume in our face, or maybe just from smiling so much. People say, hey, how do you determine how much Juvederm you're going to give to a patient or what areas are needed? Well, when we're doing a consult, I do like to take pictures and show the patient as well as listen to a patient to see what their concerns are. Some people say, hey, I used to have such voluminous cheeks and I miss that volume that I used to have. Or maybe we were just born with thin lips and they want to have a little bit of volume. Now I tell people we want a natural approach look. Why? Because we don't want anybody to know that you've had it done. We want it to where they go and question and say, wow, those lips are luscious, instead of going, oh my gosh, what did that person have done? It is very important to give it such a natural look because what we're doing is we're just rewinding those hands of time. So a lot of times people will say, where can these fillers be placed at? Well, there's 3 particular areas that I really like to put that Juvederm filler. One of the areas is going to be that cheek. Why? Because we want to kind of give him that volume back. Instead of having the saggy face, we're just kind of lifting it up to give him a more fuller face. Another area that I like to treat other than the cheeks is going to be that nasolabial area. Why? Because those lines cascade shadows, which causes people to feel like they look older. So when we put it in the cheeks, we then put it in the nasolabial area to kind of get rid of those wrinkles and fine lines. The third place that we love to put Juvederm fillers is going to be the lips. Why? Because everybody wants kissable, luscious lips. And I tell people, whether you have little tiny lips or even full lips, that's going to determine how much filler you're going to have. Some of the do's that I say with Juvederm is make sure you massage the area about 48 hours after getting the filler. Why is that important? So I tell patients it's really important because with the hyaluronic acid, it can sometimes ball. Now, before they leave that appointment, we make sure that there's no balls of that hyaluronic acid underneath that skin area. Why? Because we don't want any hard balls. We want it nice and smooth. So it's really important that my patients make sure that they massage that area. Where it's contraindicated with Botox, where we tell patients do not massage that area. Well, one important thing that I tell my patients is make sure you do not fly for 48 hours after treatment. You're saying, well, why? Because that pressure in that cabin can make that pressure build up in the lips, because remember, it's hydrophilic, so it's going to bring that pressure into the lips. And we don't want that, because we do not want anyone to look like a duck face. Another thing that I tell patients is make sure that they don't put any makeup on, or even lipstick or chapstick. Aquaphor is fine, even icing is okay, but we don't want patients to put on makeup for 48 hours. Can they clean their skin? Absolutely. But the reason we're telling them not to do that is because we don't want infection. Well, each person's going to be different depending on the look that they're going for. Like I always tell my patients, less is more. So we can always add, but we can't take out. So in general, Juvederm fillers should last about 1 year. Now, because our lips are moving constantly, as well as we're eating, talking, as well as kissing with them, we're gonna use that filler a lot quicker, as well as with exercise, that hyaluronic acid. So you may have to come in a little bit sooner, like every 6 months for it. So patients like to say, when and how long can I expect to see results from my treatment? Well, with Juvederm fillers, you're gonna see those results immediately, right when you're in the clinic. Now, I do caution patients that sometimes, because that hyaluronic acid is hydrophilic, which means water-loving, you're gonna have a little more swelling 24 to 48 hours after the injections. So it's really important that my patients ice their lips or their face after treatment, because we sometimes will get some swelling. And I tell people, don't worry, don't freak out. It is gonna come back down. And if you don't love it, I always tell patients to come back in 2 weeks so we can reassess, as well as possibly adjust the treatment as needed. So some things to remember when we're booking that consultation for the treatment of Juvederm fillers is to remember, look at your calendars. Why is that important? Because anytime we are poking the skin, remember, we can sometimes bruise, bleed, as well as have inflammation in the area. When we're scheduling an event, I tell people, make sure you have 2 weeks planned out for any event, because if we're having pictures, we don't want to have bruises in those pictures. So some of the possible side effects of Juvederm could be swelling, because sometimes when we're poking the skin, sometimes it can cause inflammation of the tissue, where when you're getting done with the treatment that day, everything looks symmetrical. But in time, when that inflammation comes down, we can sometimes use that volume, and that's why it's important to come back in 2 weeks so that we can reassess that area. Another thing that my patients, I like to tell them about possible side effects is bruising. Why? Because anytime we are injecting filler or poking the skin, we can have bruising. Why? Because we have blood vessels, and when we're poking into that skin, wherever it may be, we can have bleeding from our vessels. Another thing that I always tell and have caution to the wind is infection. Anytime we are breaking that first line barrier of our skin, which is our largest organ, to protect us from infections, we have natural bacteria on our skin. That is why it's important that we clean up all the makeup as well as the bacteria off our skin before we do injections. I am very concerned about infections, so that's why I take that extra time to clean up that skin so we don't have infections. Thanks for watching today. If you have any questions or concerns, please feel free to contact us with the information in our link below. Hit that like and subscribe button if you enjoyed the content today, and we'll see you next time. Bye-bye.